We can see the entire screen.
Is that better?
I can see the entire screen. Yep, it's good.
Okay, wonderful. Alrighty. Well, before we get off, in our area, it's very abnormal to find a residential treatment facility that is licensed and accredited. So I just wanted to mention the fact that we are a 24-bed facility licensed by the Department of Behavioral Health for residential level 3.5 and 3.3 level care. We do partial hospitalization, intensive outpatient level care as well. And we have a 3-year accreditation with CARF and ASAM. We are located in Winchester, Virginia. If you don't know where that is, it's right underneath West Virginia, about an hour or so west of Washington, D.C., at the very tip top of the state, and like 15-minute stone throw away from West Virginia. And we are right along the I-81 corridor, which makes us extremely convenient for people traveling to and from Baltimore, Pittsburgh, Philadelphia, and so forth. We are an extremely small town here, has a small town feeling to it, which is fantastic for clients that are coming here from out of town as they get settled in. It's not large and it's not overwhelming at all. And we have an extremely strong, diverse AA and NA 12-step community that we are extremely active in. So, residential treatment and what makes us different. Like I said, we are a very small, nurturing community. We have 24 licensed beds, but with our outpatient clients, we serve about 50 clients routinely. We have very small clinical caseloads, allowing for individualized treatment. Most of our caseloads are under 5 clients to 1 counselor. We are an integrative, holistic approach, focusing on healing the whole person. As I've also said, we use combination of evidence-based therapeutic practices and holistic modalities to nurture growth and transformation. And the one thing that I think that stands out besides all that is that we offer a long-term continuum opportunity that really allows our clients to dive deep into the deep therapeutic work that we offer that makes lasting, life-changing recovery possible. The more long-term that the clients are engaged with us, the longer they are successful in the recovery. So our mission, we are devoted to optimizing recovery from the grasp of addiction through exceptional quality of care using integrated best practices. There is no status quo in our approach. Our programs, facilities, and processes continuously evolve and improve to deliver the best care and quantified outcomes that we can provide. We use an innovative approach that promotes healing of the whole person, the mind, the body, and the spirit. Our programs combine proven effective psychosocial spiritual therapies and 12-step approaches with some of the most progressive modalities that there is available to restore physical and neurological health and enhance spiritual well-being. Our philosophy to a core abstinence-based program, we do not do any MAT therapy here unless the clients are active in their acute withdrawal phases, and then we will. But overall, we are an abstinence-based program, free from all mood-altering substances, and balancing neurochemical deficiencies is the foundation of our philosophy. But that alone is not enough to build a meaningful life in recovery. The design of our program, from the time a client wakes in the morning until they go to sleep at night, is deliberately structured to foster an environment for transformation. We provide our clients the skills to build a life in recovery while simultaneously working to therapeutically address thoughts and behaviors that will perpetuate this cycle of addiction. So, we are sober supported living. That's what we do to a core. We have 3 houses in our community that are designed to support our clients as they transition throughout our long-term continuum. All 3 houses are located within a mile from our clinical building in downtown Winchester. They're very cozy, very home-like, very much so to where we have 2 clients to a bedroom, we have a dining room, we have a living room. Very much you walk into the house or you drive by in the community and you would not think that we are an institution by any way. We do not want to feel institutionalized, but we instead want to structure our residential treatment to be you're coming home every night from the clinical day, you're going to work every day by going to the clinical building. So it's very much replicating the home life and the work life and the skills that they need to be able to do that when they transition home. And that is our goal when we replicate them living with us and then coming to our building every single day for their job, if you will. Our residential living is, as I said, very community-like. We have home-cooked meals. We have them work on therapeutic assignments. They enjoy sober activities together. We transport them to and from our residence every day. We have them pack a lunch every day so that they can get into the habit of, oh, I need to take my lunch to work every day instead of stopping for fast food. So we very much stimulate that normal day-to-day living that you need to do in order to be successful. We offer a comfortable, supportive living arrangement to teach the clients how to live. They have to do chores every day. They have to make sure their beds are made, the house is cleaned up, all that before they leave to come to the clinical building. So the benefits of residential treatment, we offer 24/7 around the clock monitoring and support. We have a wake staff 24/7 that they are all trained in medication administration, in CPR, first aid, all that. We have focused attention from all of our staff. We offer distance from the everyday life distractions. So away from work, away from family demands, away from social demands, and then separation from, where they're actively using, away from, the dealer on the street that says, hey, do you want to hook up today? So we want to take them out of their environment, put them in a facility where they are free from any distraction so that they can focus on their recovery. We are extremely structured in our day-to-day routine. They get up at 6 o'clock in the morning and we get them going until 8 or 9 o'clock at night. And we find that having a very structured routine helps them become productive. And we know that boredom tends to lead to using. So we keep it very structured to show them what they need in early recovery. The long-term continuum research has shown that clients who engage in treatment for longer have higher rates of life-lasting change. Our continuum allows our clients to progress through the program at a pace that fits the severity of their disease, allowing them adequate time to heal at their individual needs. We have a four-phase program approach to treatment that I'm going to go into. So the phase 1 of treatment is commonly known as residential treatment. This is focused on the medical stabilization that is needed after detox. We give them education every day to focus on learning about the disease of addiction. They are able to build a foundational knowledge on their relapse warning signs. They start building their recovery toolbox. The clients learn to live comfortably without mood-altering substances. We implement our amino acid program on day 1 and nutritional healthy eating to rebalance the depleted neurotransmitters as a result of their drug use. And they're able to establish a personal spiritual program by attending daily AA or NA meetings in the community and start building a network and a sponsor. Phase 2 of our treatment is commonly known as partial hospitalization treatment. It is where the clients receive advanced education on grief, shame, boredom, codependency, anger, and this education is framed within the context of relapse prevention and understanding the long-standing habits and beliefs that, if mismanaged, results in relapse behavior. They receive very deep personal assignments that develop a deeper understanding of their triggers, warning signs, and coping skills. They receive privileges to navigate being out in the community in the evenings and weekends to help build a network or support. And the clients have the option of living at home or continuing to live in our supported living arrangements, which is what uniquely sets us apart. So if they choose to live in our houses, then they have increased structured freedoms and expectations of autonomy and responsibility with an accountability system, while having safety measures like breathalyzers and urine drug screens daily. This gives them a safe reintegration into everyday life with support. We offer 24/7 residential staff who will monitor them as they go out and about in the evening. They might go to a meeting by themselves, but when they come back, we have the support that they need. The community living allows clients to focus on recovery, practice the skills they learn and apply it in real time, build their recovery network, and enjoy sober activities together. They get to practice essential skills for transitions back to daily life, such as attending treatment during the day, simulating a work day, and managing pro-recovery behaviors. This allows clients also to continue to receive the amino acid therapy. If they just do phase 1 with us, they only get the aminos for 30 days and then they go home. But staying with us, they're allowed to continue the therapy, continue to get a fully stocked kitchen to ensure transferability of the nutritional philosophies, and the ability to participate in our trauma track, allowing clients to dive deeper into their core work that's needed. Once they're done with phase 2, which is about 60 days into treatment, they will usually transition to the intensive outpatient treatment. Clients that shift and this allows the clients to shift from deeper therapeutic work to transition back into navigating life in early recovery. It's a very slow taper process that supports the clients in finding meaning and purpose in recovery as they explore options for employment, education, and their overall life goals. By staying engaged in treatment, this allows the clients to remain accountable to the self and the peer community. We also offer living arrangements for our clients in phase 3 of treatment that I'll go into in a minute. But phase 4 of treatment, this is commonly known as outpatient level care. Our aftercare program that they're involved in gives them 2 peer-led process groups a week and a weekly individual session. This allows for additional support as our clients practice maintaining sobriety while living their normal life, returning to work, possibly living with their family. It gives them a higher degree of accountability and support as they identify and process high-risk situations that can trigger relapse. It gives them involvement into our alumni program. So phase 3 and 4, we do have a house for them. It's our peer-supported house. We do not have staff that oversee it. So it's peer completely run and it's peer managed. It allows for them to have more accountability, weekly drug screens, breathalyzers as needed. So it's basically giving them a safe haven for navigating early recovery. It's almost like living in an Oxford house, but only for our clients that go through our continuum. And it's extremely comparable financially to the Oxford houses. So our clinical program is a comprehensive biopsychosocial assessment on day 1 that is the cornerstone for craving a personalized treatment plan. Our individualized person-centered treatment is centered around healing the mind, body, and spirit. We offer therapeutic approaches and interventions that are uniquely grounded in evidence-based practices to address addiction effectively at every stage of treatment. Things like education every day. Every day we have a process group that is peer run, clinician sets in on it, but it allows them to go into what's going on in their day, assignments that they've been working on, challenges that they've had. We have CBT every day, DBT every day, and then we do things like creative expressions, music therapy, meditation, go into recovery literature like the Big Book. We use motivational interviewing. We work with polyvagal practices. So there's a lot of techniques that our clinical programming does, but I'm not here to talk to you about that. I want to talk more about our holistic modalities that we offer. One thing that really sets us apart is our trauma therapy that we do. If our clients decide to stay with us more than 30 days, once they're stable, then our clinical team offers them our trauma therapy. This is allows us to get to the roots of their addiction and the roots of their disease. So a lot of grief that we see, a lot of trauma, PTSD, and our clinicians are extremely trained in it, but we can't work on it to a deep extent unless they stay residentially with us. It's like we have to unzip them to get to their core issues. And then if you let them go home every night back into their using environment, then they're at high risk of relapse. So we like to unzip them while they're living with us so we can work on these core issues while they're being supervised 24/7 and then zip them up as they're getting ready to go home. So it's a very long, slow process. So if they can stay with us more than 30 days and they can commit to the 60, 90, 120 days, then we really work on the underlying issues that they have more extensively through trauma therapy. Our one clinician is trained in brain spotting. Brain spotting is an evidence-based tool that identifies targets, processes, and releases overwhelming physical and emotional memories at the subcortical level through certain eye positions called brain spots. By working through these memories and applying grounding techniques, clients are able to emotionally regulate, lower anxiety, and ultimately reduce cravings for substances. So the holistic modalities that we offer. So we have a multidisciplinary team that offers a range of modalities that we do every day. Our first one is the amino acid therapy. I think everybody here knows about amino acid therapy well enough. I hope, but on day one, we evaluate the clients to see where they're deficient in on which neurotransmitters. We will then make an individualized treatment plan for them, if you will, with amino acids and offer them the cofactors, the vitamins and nutrients that they need as well to support them. We give them amino acid therapy, breakfast, lunch, dinner, bedtime, as they need throughout their stay with us. A lot of treatment facilities that you go to will give like trazodone or Seroquel at bedtime, but we are 100% abstinence based. So our philosophy on sleep is let's give you melatonin, let's give you magnesium, let's give you glycine, let's give you tryptophan or 5-HTP, you know, to really help them with their sleep hygiene. I know that sleep is usually the number one thing that I have to alter in their amino acid program while they're with us, because either they can't fall asleep or they can't stay asleep or they're having vivid dreams. So we're constantly tweaking our amino acid therapy to help them with the discomforts that they're in while they're here with us. We focus our nutritional values on a pro-recovery diet. We focus heavily on protein and eating the rainbow, if you will, with the fruits and the veggies. We do not do any caffeine. We do not do any white sugar or white flour or processed food. So we're very healthy, clean eating. We have a weekly nutrition education taught by our nutritionist on the importance of eating a high protein diet in early recovery, on gut health, and the essentials to eating once they go home. Our clients receive weekly hand-on activity sessions, so where they get to learn cooking skills and they get to learn how to make unique dishes that are healthy for you, or skills with properly cutting. A lot of clients come in and they've never boiled a pot of water before in their life. So we might be going back to the very the very basic skills to very more elaborate. We serve clients from the age of 19 to 75, 80. So it's a big variety. And we expect them every evening that they're going to cook dinner together, a family style dinner, sit down together. So we have to work on them with learning how to use the tools that we have in our kitchen and how to cook healthy in order to feed everybody every night. So we really focus in on them with that. And then we allow them to take our recipes home with them at the end of their treatment so that they have very simple, easy meals that take 10, 15, 20 minutes and they can take them home. So when they go home, they go to work and then they have to go to a meeting in the evening. I don't have time for dinner. Oh, but wait, we taught you, here's a quick, easy 10, 15-minute meal that you can cook real quick. So we try to keep everything that we do and you can take this home and apply it in real life. Physical exercise is extremely important to us. We prioritize it every day, and people really don't like us because we start at exercise 6:30 every morning. But we promise if you start exercising, you will feel better. You will sleep better. You will have more emotional regularity. And it's amazing when the clients first come in and they say, I can't get up at 6 o'clock in the morning. You want me to exercise right away? But once 2, 3 weeks comes in and you see the lights flip in their brain and you're like, oh, okay. And they're like, oh, I actually slept well. I feel better. I do this, I do that. We're like, huh, yeah, probably because you're eating right and exercising now, and taking your amino. So, but it's the foundation of who we are, is our nutrition and exercise program. Weekly, we offer a weekly yoga session taught by a certified yoga instructor. We find that clients come in and they're very hesitant of yoga and say, I can't do this, I can't do that. By the time they leave here, they love it. They are able to do the poses, they're able to meditate, they're able to help with their breathing techniques to reduce their anxiety, to reduce their stress, and their physical issues as well. We also do neurofeedback here. In early recovery, we find that people's brain waves can be either over functioning or under functioning, and they need to be either calmed down or energized to achieve optimal functioning. So we use neurofeedback to mirror brain activity to convert brain waves by using visual and audible stimuli to teach the brain to self-regulate how we feel, think, and deep. We use it to help treat not only the disease of addiction, but also the underlying issues like depression, insomnia, anxiety, the ADHD, the ADD, PTSD, trauma, stress, fears, and more. And then we do AccuDetox. We have 3 of us here that are certified in it. AccuDetox is a nonverbal approach to meditation where we place 5 sterile needles in the ear and it will help relieve withdrawal symptoms. It was originally created, if you don't know, in the Bronx back in the 70s to help with opiate withdrawal. And we find that our clients that do AccuDetox daily, their opiate withdrawal symptoms, or in any other withdrawal symptoms really, dramatically increase. And they feel a lot better. They have better control of their anxiety. They have sleep improvement. They are less depressed. It's really helping them find that inner balance and being able to have the resiliency that they need. We also do massage and Reiki. We have a massage therapist that comes on site twice a week. That offers massage sessions. She offers the Reiki sessions. And as I said earlier, we are huge proponents of the 12-step community. We go into the AANA community every single day and twice every day on the weekends. We teach our clients that not only do you need us as a support, but as you transition through the continuum, as you transition home, you need to have a network of people outside of us to be able to support you. So we have every client as they transition from phase 1 into the second phase of treatment into, day 60 plus, that they are actively working with a sponsor, that they're building a network, that they're getting phone numbers, that they're using those phone numbers to talk to people outside of us so they can have as much support as they need for when they transition home. If our clients are not as spiritually based and they want an alternative, we do help them with finding refuge recovery meetings or smart recovery meetings as well. So, as I said earlier, we have a very, very structured day here. We start every day at 6 a.m. We exercise for an hour in the morning. We have them cook a healthy breakfast. We have them pack a healthy lunch to bring to the office every day. They are here by 8:45 in the morning, where they have an hour and a half of education every morning on the disease of addiction or the other topics that relate to their disease. We have an hour and a half process group every day. Then they break for lunch. We come back in the afternoon and they have some kind of CBT activity or group where it's either the big book or the living skills, recovery literature, that kind of thing. And then they go into the activity group therapy. We do creative expressions. We do music therapy. Yesterday we did an origami class. We've done face mask class before. You name it, we've probably tried it. In the afternoon, every day, we either offer meditation, a form of it like AccuDetox 4 days a week or yoga. And then at the end of the day, my residential staff comes in, they take over, they take our clients back to the house, and that's where they will cook a meal together. They sit down and eat a meal together, family style meal. They sit down and do the 10 step together. So they go over, basically a daily amends process or a personal inventory. They see where did I have challenges today? Where did I succeed today? What did I do for somebody else that had nothing to do with me? Those kind of questions. And then they can get their peers feedback on it. And then we take them to a meeting in the evening. Come back to the house around 8-ish. They get a 15-minute phone call every day to call their loved ones. If they have a sponsor, they get another 15-minute phone call. They work on therapeutic assignments, and then they can go to bed. But it's a very, very structured 16, 18-hour day. And then we also have a family programming. Every week, we offer our clients to have visits from their loved ones on a Saturday. But in order for their family to be able to come visit, we require the family member to participate in our family education, because we know that the disease does not just affect the addict, that it is a family disease and it affects everybody in the family. So we want to be able to teach the family members about the disease and about the underlying issues and about what their clients are going through. So every week the family has to attend a 2-hour family education session, and if they attend, then they get a visit their family on the weekend. We also offer family conjoint sessions, which is where you basically have our family therapist and the family member, and then we have our client and their clinician, and they all get together for a big meeting, and they get to talk about reintegrating or issues that you have at home or how to maintain boundaries once they come home. So basically one big session where each member has a therapist on their team to help open up the field of communication and the needs. And then just like we have an alumni program, we also have a family alumni program where they can continually have weekly sessions to talk about their struggles that they have with a family coming home, or their successes, we highly recommend family members to participate in Al-Anon so that they're getting the support that they need as well. And then that is basically all I have about residential treatment. But I wanted to let you know, in case you were interested, we have our admissions director that's on call 24/7. She answers the call whenever a phone call comes in. She will do a pre-screening application. She will run benefits. And if they are acceptable for treatment with us, then she'll either send them to detox if they, especially if they're benzo or alcohol users. If it's opiates or stimulants, then we can handle it in-house. And then she schedules them for an intake. So it can be a very quick process if the loved one is willing to make it a quick process, or it's a long drawn out process. But we are ready and available 24/7 for any calls that come in. We are in network with Anthem Blue Cross and all the blues out there, Humana, TRICARE, out of network with Aetna, Cigna, United Healthcare. And we usually try to work with any insurance providers out there. We do not take Medicaid or Medicare at this time. And of course we take cash. So I talked really fast and I'm sorry. It's what I do when I'm nervous. So can I open the floor to any questions instead?
So thank you so much. This was really fantastic. I really learned about your program. So I have a couple of questions before anyone else does. So the 3 houses that you showed, is one residential,
Yeah.
one is outpatient, and one is, like, each of the houses have a different function. Is that right? One is a
Right.
sober
So
house.
our first house is designated for residential level of care, where they come in and they are very strict, very structured schedule. They have 24/7 staff there, and they're there for the first 30 days, give or take. And then if the client decides to move on with our program and commit to another 30 days, they are given privileges to where they can have their cell phone in the evenings. They can go out and about in the community in the evenings. They have to go to a meeting every night in the meetings, but there is a house for them where it's more peer run, but it's staff overseen. The staff is there 24/7 to make sure they're back by curfew, that they're taking their medications, they're there for an emergency. So it's not as structured with the entire go, but it's okay, you learned everything in the first 30 days. Now you're going to apply it and we're going to oversee you implement it as you start having more freedoms and privileges.
And that's the sober house.
That's our supported sober house. And then when they get to the point where they are slowly tapering back into society, when they start going back to work and they taper out of all of our day treatment classes, they can move into our quote unquote Oxford house, if you will. It's our sober house where it is peer run. Everybody has to go through our program in order to be eligible to live there. So it's a tight community that knows the BTG way, but still has our staff available from a distance, like a phone call away, if anything was to go down and they needed assistance.
That's excellent. So it sounds
So
like
we offer housing through the entire program, but as you go longer into the program, you get more freedoms, more accountability, as you start tapering out into a very real world experience, if you will.
the first month. So the first house is 1 month, then 60 days. And the third one is how long? Is there a time limit, or they
As
can
long
stay
as they need it. We've had anybody there for 30, 45 days to 3-4 years. So it really just depends what they need and how long they need that support, and to get back on their feet, to get a job, to be able to live life. For the entire time they're living in our third house, they might be working a full-time job, but they're still seeing our clinician every week. They're still doing a peer run group every week. So they're still having that accountability support. They're still having weekly drug screens, weekly breathalyzers, as they're navigating life.
And insurance covers all 3 phases?
Uh-huh.
The one that you mentioned? Okay, perfect. No, that's great.
Yeah.
That's great. No, that's excellent. And anyone else with questions? I have a couple of other questions. Pam?
What's up, Pam?
Hi, I have a question. Oh, Pam, go ahead.
Oh, that's okay. Go ahead, Heidi.
My question was wonderful presentation. Thank you so much. And I love that you're using the amino acid therapy. And my question is, are you doing IV administration, or do you use capsules? How do you manage that part? And is there a daily kind of check-in on the amino acids? Thank you.
So when Bridging the Gaps first started, we used to do IV therapy for stabilization and then the oral aminos. But then the pandemic happened and we lost the compounding pharmacy. So it's something that we are desperately wanting to restart the IVs, but for now we're just doing the oral amino acids. The clients come in and we do an assessment with them and we start them on amino acids, and then my residential staff makes little nutrient packs every night, and that we literally administer them daily during their time, so either breakfast, lunch, dinner, bedtime, and we administer them to them every day, and we watch for compliance. So we literally sign in our medication book if they're taking their nutrients or if they're having issues, if they refuse it. So it's very well structured and monitored and not a free-for-all. Does that answer your question?
That's great. Yeah, and do you reevaluate which amino acids they need on a regular basis?
Yeah. So part of our doctor's appointment that me and the doctor does weekly with our clients, we sit down and we ask them, you know, are you sleeping okay? Are you having problems falling asleep? Are you having problems staying asleep? Or are you more anxious? Or are you more depressed? Or we might pull out the amino acid chart and have them redo it to see if the symptoms from day one correlate with the symptoms now and how we might need to trigger or tweak it. Not only do we have our base of amino acids that we give every day based on their disease and the symptoms that they're having, but just like we have over-the-counter medications, we also have basically over-the-counter nutrients. So if you're having anxiety, here, let me give you a GABA or let me give you L-theanine. Are you having cravings? We have L-glutamine and inositol powders that we give a lot of. For cravings, we find that it is very helpful. So it's like every time you fill up your water bottle, let me put some more powders in there to help you with your cravings, you know. So we have not only the over-the-counter quote unquote part as needed, but we're constantly tweaking to see how we need to adjust our treatment.
Did
I
you say
love
you
it.
gave
Thank you so much.
glutamine? Sorry, glutamine and what else for the cravings?
Inositol.
So you put inositol and glutamine together? How many scoops do you use?
The bottle says to do 1 scoop for about 8-10 ounces. We give
Okay.
them a 16-ounce water bottle, so usually we do 2 at the beginning, and then we'll go down to 1. It depends on how severe their cravings are at the time.
So you'll do 2 of each, 2 scoops of each?
Yeah.
Or 2. Okay.
And if
No,
they
that's
don't
great.
like it, because it's a sweet tasting flavor, if they don't like it, we'll say, well, let's put some lemon juice in it, you know, or I have a capsule, I can just give you a capsule of the L-glutamine instead. But a lot of times we find, because they're so anxious when they first come in, and they crave a lot, so we're like, well, let's just sip on this for, you know, whenever you sip on your water, let's just sip a little more. And it seems to really help their cravings.
What kind of addictions do you, actually, Bruce, go ahead, Bruce, and then I'll ask.
Yeah, sorry, I'm outside. Yeah, I wanted to just get your overview about aminos, different categories. You've addressed some of it already, but what you pull from as far as aminos for different categories, including sleep and that, or alertness or lethargy, or you've addressed cravings and anxiety and that sort of thing. So can you just give your general guidelines of your menu for aminos from an oral sense? Thank you.
Sure, I can. I'm actually gonna pull up this if it will help you to see it visually. Can you see my screen? So we
Yes.
put every client on a detox pack when they come in. That includes NAC alpha lipoic acid and probiotic complex. We typically give that across the board to every client. And then we give them a questionnaire to figure out what their deficiency is. We are looking at the serotonin pathways, the GABA pathways, the dopamine pathways, and the endorphin pathways. So we figure out where they're deficient in, and then we give them the packs that we make that's specifically for that deficiency. So if they're an alcoholic coming in, usually we find that they are deficient in serotonin and GABA. So we will give them a serotonin pack in the morning, usually a GABA pack in the evening, unless their GABA and anxiety is through the roof and their GABA scores are higher, then we'll give them GABA twice a day, the packs. If they are a stimulant user, usually we find that they are deficient in the dopamine. So we'll give them dopamine in the morning, which has a lot of tyrosine, glutamine, and DLPA. And then if they're a opiate user, then we find that they are low in endorphin. So we'll give them our endorphin pack. And then as sleep, you'll see our sleep tonic here is our base of what we do with the magnesium, the 5-HTP, melatonin, P5P, and niacinamide. And then we will tweak it, we'll add, we'll decrease. We're big people of adding glycine for if they can't stay asleep at night, or if they're not having night terrors, vivid dreams, we'll take the 5-HTP out, we'll substitute it for tryptophan. If there's still a problem sleeping, we might add some valerian root to it. So it really just depends on the symptoms they're having. As needed, we do a lot of GABA as needed for anxiety. We do a lot of tyrosine if they're having problems staying awake in class and need some help with alertness. If they're having concentration issues, sometimes we'll add carnitine to it for the ADHD clients. Did that help?
Yeah, excellent. Thank you for sharing the chart.
No problem.
What was that last one that you added for the clonidine, did you say?
For
The last thing that you said you would add?
for the sleep?
Carnitine. Yeah,
Carnitine.
For-
Yeah, we do carnitine sometimes for
Oh,
concentration
carnitine.
issues.
Oh, thank you. Carnitine. That's great. Thank you.
Pam, you had a question?
Yeah, so you mentioned aftercare and outpatient, kind of going through to kind of after they've been through the program, and you said, and I can't remember what you called it, but it was, the extension of towards the end of moving them into society, but you said only those who have been through your program can do that. Do you ever discuss that with people who have maybe been through someone else's program and that was the other question I had. You said that something about MAT therapy, and is that medical assisted therapy where they're using psychotropics? Okay,
Yeah.
So say that someone has been through a program that pretty much was clean of psychotropics, except for they used like you said, the trazodone in the evening. Would you ever accept someone in an outpatient program?
Yeah, outpatient wise, absolutely. We would definitely do the outpatient. Inpatient, we may not, and we might find alternatives if they were on benzos. If they're outpatient, they're coming in IOP and they take trazodone at bedtime at home, that's one thing. But if it's in the office or in-house with us, that's a different thing. But for our IOP or OP, then we usually don't mess with their meds and we allow them to come in, but we monitor to make sure that they are not abusing it.
Right.
So like if they come in on gabapentin, then we can draw levels in their urine to make sure that they are not abusing their gabapentin.
Right. No, this person isn't on any of that. It was just, they came from a clinic that did use it, but she didn't, and it was just alcohol. But my other question is, do you ever do remote? Like they live across the country, they're not able to be in Virginia. Do you ever do you have any type of remote program?
So and go back to your original question, yes, we take clients at any of the little cares, especially if they've been in the treatment before. We just had a client come in today who got out of a facility for 30 days and wants to step down and do the next level of care, so IOP. So we are bringing in IOP level. So we do definitely continue the treatment process if they've been to another provider. Absolutely. We do, ever since the pandemic, we have become very good at virtual. We do virtual PHP, IOP, and OP. But we would request or require like weekly drug screens to be submitted, like via LabCorp, so that we can monitor for sobriety. And the aftercare program we have where they can definitely do outpatient sessions once a week. But our aftercare, the actual aftercare program is where they have it's an hour and a half peer run process group in the evening once a week, and hour one in the morning that's peer run as well. Those peer one are the ones that they've come through our curriculum, they have a community already, and they're continuing as they taper out. But we have done it many times where they've come in, they've done PHP or RTC somewhere else, they come and do IOP with us, and then they choose to be part of our aftercare program because they are still our alumni, if you will. So they can definitely come in and taper through the process with us.
Thank you. Excellent presentation, by the way. Love everything you're doing and that you guys are keeping everything so clean.
And it's so
Clean.
exceptional. It's
It is.
exceptional across the country to find programs like this. Any other questions before I ask my question? Anyone else with questions? So which kind of amino acid chart do you use?
We have one of our own that we
Your own.
use. I have recently started integrating the amino acid therapy chart that Christina
Okay.
gives us. So I've recently started implementing it so that we can see if one is better than the other or if they are the same, so we have our own.
Yes,
But
and then
the
you
one that we have was originally helped design by Julia Ross when she had been here. And she is the one that really came and spent hours and hours way back when helping us design our amino acid program. But it's not her original chart that everybody knows.
yeah, it's different. And so it sounds like what you said before is that you just do a review only if needed. Otherwise, the individual stays on
They
the
usually
same.
stay on the same one because it's related to their drug of choice. And then we add things and take things away based on the symptoms they have. But every single week, they are meeting with the doctor and me, and we review it.
And
to see if we need to tweak it.
what kind of a doctor do you have that would that's okay with amino acid therapy?
When I worked at the jail setting, I worked with a provider who's a medical director at a hospital in Virginia. Formed a very close relationship with him. So when we lost our doctor here that is an integrated doctor, we called on him and he was able to step in to help us. So even though he's a ER physician, works in corrections, does all that, he firmly believes the amino acid and how much it helps us. So we have him and his couple of his PAs that rotate in and out of here to provide their medical care.
That's excellent. That's again exceptional, right? Like it's not something that you see routinely.
I think it's because they've worked in the field so long that they see that the other things are not working. They see people coming in, they see people, that abuse MAT all the time, especially because they work in the correctional settings as well. So they say, okay, well, something else needs to work because this is not working. What else works? And going back to the root of what we do really resonates.
So one of the biggest challenges in substance use treatment is the relapse, right? And I don't know if you track the individuals that come to you and see how they do over, say, 6 months, a year, 3 years, 5 years.
We just started tracking in the last couple of years. It's a new metric that we started last year. But we find that those that stay and go through the continuum that are here longer in treatment, the longer they're in, the longer they stay sober, most likely. The ones that come in for a 28-day in and out program usually end up relapsing within a couple months. Those that really get into the amino acid therapy and they continue it through the entire time they're here, and they get to the deeper therapeutic work, you're talking about years and years of recovery compared to the ones that are in a 28-day and in and out with us or anywhere else.
Yes.
Much higher rate of success.
Yeah,
but
I
it's
think
really
that's what
building that network and getting to those root issues and really working on that stuff to then have lasting recovery.
No, I agree. Yours minimum sounds like maybe 3 months, right? Like 30 days, maybe
Usually-
six.
Usually, and we'll take them for 30 days. We try to get them to stay, but it's very routine, 90, 120, 150, very routine.
So the other question is maybe a comment rather than a question is maybe like depending on what you find, maybe I wonder if the success, like when you're getting your data, would be higher if you're able to refer these individuals out to like people who know about amino acid therapy, right? Like if they're willing in the community, right? Like say they're coming from, say, Denver, Colorado, and in that instance, after they finish your program, is to refer someone locally or
Oh,
someone who will
absolutely.
follow them over time to stay with. That would be great to know. Like if you stay with the amino acid therapy and then, you have to probably change it around over time, that there's maybe a longer lasting effect of the initial, treatment of a mom.
Right. When our clients transition out, we do, collaborate with their doctors, and we do provide them, like letters and stuff saying, I went to treatment. I have an allergy, if you will, to mood altering substances, so I can't be provided anything. So we do try to collaborate very closely when they transition out. Even when they're in treatment with us, if they want to see a specialist, we work with them to be able to get to a specialist, a psychiatrist, any kind of doctor, really. But when they go home, we also give them our recommendations of what to continue, why to continue it, how long to continue it, and we try to hook them up with integrated providers in their area for basic medical care regardless.
Right. Yeah, it's hard to find integrative providers in the community who accept insurance and, who
Right.
are willing to do amino acid therapy.
Yeah, probably 3 o'clock.
But maybe people like in the amino acid club, amino acid group, maybe, those kinds of individuals would be appropriate. So
Right.
other questions?
I have one more question. I'm wondering if you do any kind of routine blood work or and or testing for neurotransmitter levels. Are there any reliable tests that you use? Do you do routine blood work, that kind of thing?
Yes and no. Everybody that comes in, we draw their blood to get a basic CBC, CMP. We check thyroid levels, we check for diabetes, we check for STDs, we check for vitamin D levels. Pregnancy. We do the basic like that. So we do a little more than normal, but then depending on their symptoms, we can draw more blood and see what more or whatever comes up. So basically the most amount you would say is vitamin D then in that list, or thyroid issues in that list. So we don't do a whole lot of labs based on aminos. So no, but to a point, yes. Does that make sense? So some labs, yes.
Yeah.
But
So
we
there's
take it
not
more from a
really-
medical approach with the labs.
Okay, so my understanding is there's not really any reliable neurotransmitter tests. Is that your understanding?
Not to my knowledge. I
So
think that's
actually
would be
that's
better
a
to question.
Yeah, that's a segue because our next month's speaker is going to be talking about neurotransmitter testing. She is from a company that does neurotransmitter testing, Neuroscience Solutions, and they do a test called Senesco. And there are a couple of other companies across the country that do neurotransmitter testing. So please come and ask all your questions. And at the end of this presentation, I'll just put up a chart of our next speaker. So the next speaker is going to be on August 28th. It's going to be Dr. Kasagan for Neuroscience Solutions, and she's going to talk about neurotransmitter and cortisol testing. And then after that, we're going to have Julia Ross herself coming and answering questions and doing a small presentation. And then we have a couple of other speakers. We have a speaker talking about acupuncture and another speaker on ketamine.
Great, thank you.
So Pam, you have a question? And so these are these are the lectures here. And please join the Alliance for Addiction Solutions. You can get recordings of all our monthly meetings. Go ahead, Pam, sorry.
That's okay. I was wondering if Ashley would be able to share her amino acid chart for their with us or if that's a no-no.
Sure.
I'm just curious how it is different from, I mean, obviously Julia was part of it, but I would still just curious to see it.
Yeah.
Oh. This looks very much like what Dr. Gant has, actually. I have to look at it in detail, but Dr. Charles Gant.
Is there ability to maybe get a copy of that? I was trying to screenshot it, but there's too much to it.
Yeah. Yeah, it's a 3-page questionnaire that they
Yeah.
go through. And then we have our protocols of what we like, the cofactors and everything that we add to it. That's not on here. But we have a whole protocol of the other stuff that we add as well. I was trying to find it real quick, sorry.
That's okay. This is great. Thank you.
No, not that one. But if you see here, these are the labs that we give, that I ran through, and then these are all of the nutrients that we usually do. We don't do every single one with every person, but it's basically the foundation of our program. And some of it might need tweak based on allergies or based on symptoms that they're having, you know. Some of it we may not do, but for across the board, it's very similar, at least as a starting point.
Thank you.
But I could send it to you, Pam, at some point. I don't mind that.
Oh, that'd be great. I'll put my email in the chat. Is that the best way?
Sure.
So any other comments, questions? It's top of the hour. Well,
Hi, Ashley. Thank you for the great presentation. Actually, if there is a way that you could just share with the Alliance, the way the members can get it, and not just Pam, because I'll be interested in taking a look at that too. This will be great. And,
Yeah,
and I love what you're doing that. Thank you.
yes, that'll be a perk of membership, actually. So that'll be great. So Ashley, Anne will be in touch with you, and then maybe you can give, if you're willing to share, if you're willing to share, then we'll put it on the Alliance's
Okay.
somewhere. Alliance, we'll figure it out, maybe near your presentation or attached to the presentation. There's a, with the recording.
No problem.
Thank you.
No problem.
Good suggestion, Salvatore. All right, anything else? Any other comments, questions? Again, thank you so much, Ashley. It was awesome. It was really, really awesome. I learned a lot about your program, and thanks for doing the presentation. And everyone, please join the Alliance and support the work that we do. We're a unique organization. There's no one else, doing amino acids and sort of the holistic approach based on aminos and boosting the neurotransmitters.
Thank you.
All right. Thanks, everyone. Have a great afternoon, and we will see you next month, August 28th, for neurotransmitter testing.
Thank you. Bye-bye.
Thank you.